Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.
Let's go!
Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo, Animalu, infectious disease specialist and HIV specialist, and a professor of medicine at the UT College of Medicine. And today I have a very special guest with me. She's a close friend of mine, a phenomenal physician, and the immediate past president of the Bluff City Medical Society here in Memphis, Dr. Michelle Kitson. Welcome to the show.
Thank you so much.
So today we will be talking about the health disparities, not just in total, but in our Memphis community, which is our dear community. And what this means basically is to discuss those issues that do affect the minority populations or communities here in the Memphis area. And so I'm going to start this off with, talking with Dr. Kitson. She's an expert in this field. And so she's going to give us a little bit rundown on what health disparity is all about. Dr. Kitson.
Thank you so much for having me, Dr. Chi. So health disparities are social, economic, educational imbalances that tend to impact health outcomes. It impacts how people interact with the healthcare system, and ultimately can lead to shortening of patients' lifespans, huge economic losses with time missed from work because people are unwell. They're not able to engage in the system when there is no disease, so we can work on the preventive side of things. And therefore, when they do come into the healthcare system, the cost is tremendous because due to a lack of education, a lack of access to good food, and other things like understanding what are activities and actions that would lead to good health, then by the time they engage with us at the healthcare system, particularly in the emergency departments, things have gone way further than they need to. And so with a lot of minority populations within our city of Memphis, there is a lack of access to good food. There are lots of communities that do not have supermarkets. There are lots of communities that do not have access to transportation. If you can't go to the supermarket, if you can't go to the farmer's market, then you don't have access to good foods to promote good health. And if you don't have the right nutrition, then that leads to the development oftentimes of chronic medical conditions like high blood pressure and diabetes, which then can lead into end-stage kidney disease, which of course then can drastically reduce the quality of life and the length of life.
Absolutely. This is amazing. Now, let me ask you, you are a practicing physician. In your practice, is this something that you have seen that's kind of rampant? You've seen kind of experienced this amongst your patient populations?
Absolutely. So I trained in Nashville at Meharry Medical College, and a big part of our training was to serve the underserved. And that's actually what led me to this community. Even though it's urban and not rural, there are lots of health disparities that exist, and therefore lots of underserved populations. I work in Midtown. I work with a wide range of ages of patients, and while I do have a few who are affluent, there are many of my patients that are struggling to decide whether or not they can afford to pay for medications, buy good food, keep a roof over their head, the quality of the air that they're breathing. As we are getting closer to hot weather, it is tremendous the number of patients that are struggling to pay their utility bills. With the cost of living rising every day, these are all things that increase stress in patients. With increased stress comes increased inflammation, and it actually does a really big number on so many aspects of the patient's life. Their mood, when you're depressed, you're less likely to eat healthily because you'll be more attracted to things that are high in fat and high in sugar. Those then lead into the possibility of developing heart disease, developing obesity. And unfortunately, a lot of the treatments that are effective and available to treat those diseases are way beyond the reach of a lot of the patients that are in the catchment area that I take care of. And so yes, unfortunately, it is heartbreaking, but there are many people, both children, young adults, middle-aged and elderly, that are suffering needlessly because there's such a great disparity in the lack of access that people have to good nutrition, good information, and of course there's lots of misinformation that's available readily on those devices we call cell phones.
Absolutely. So, I mean, what you just talked about, what you just mentioned is also something that, is around us that, is very common. I do see that in my own practice too. But I'm just kind of curious though, we talked about, one of the things you mentioned was, things like depression, and mental health. Mental health is something that I know is part of, when we talk about health disparity and inequality, is something we tend to worry about, especially in the minority populations. Is that something that you've seen also, like patients? Because I'm just going to assume that someone who does not have enough food, do not have transportation or able to get to the supermarket, have good school system and stuff like that, I would just assume that you're going to worry about the mental health part of that, the mental health impact. What do you think?
Absolutely. The tragedy there is that for very many years, society didn't value mental health professionals, psychiatrists, psychologists, behavioral therapists. And with us recently experiencing a completely life-altering pandemic, where we were isolated from each other. We are meant to be community. The truth of the matter is, from the beginning of time, we've always tried to gather with people that recognize and share common goals and thought processes. And so when people were isolated from each other and unable to interact, we saw a tremendous uptick in conditions such as major depression. And when you don't have access to professionals to help you cope well, then people tend to turn to coping mechanisms that actually make things worse. Alcohol, smoking, vaping, the use of these substances to try and escape. But typically what then tends to happen is that they exacerbate or worsen things like asthma and COPD and heart disease. And so it's been quite tragic. The truth of the matter is, if my patients, who are typically adults, come in seeking care for me for their high blood pressure or their diabetes, if I am treating them for these conditions, but I am not addressing the fact that the reason they are eating poorly is because they don't have access to things that are more nutritious for them. If I'm suggesting to them, hey, why don't you try eating this, that, and the other, but they can't actually afford it, then I'm not really helping any. And so that increases the depressive symptoms.
Absolutely. Thank you, Dr. Kitson, for that piece. This is Medical Class 901 with Dr. Chi, and we're going to take a short break and we will be back. Welcome to Fun Facts with Dr. Chi. I am Dr. Chinelo, Animalu, Infectious Disease Specialist and Professor of Medicine. So we're going to talk about just some basic points to know about HIV. So what does HIV mean? Human immunodeficiency virus, which is a virus that we can pass from one person to another through sexual intercourse. sharing body fluids or through blood transfusions or by sharing needles. About 39 million people are affected worldwide, and it's a major cause of mortality in the world, meaning death. It causes death. And and part of HIV is called the AIDS, and this means somebody that has untreated HIV infection, and this would have run for many, many, many years, and sometimes some decades. You do not get HIV from kissing, from hugging, from sharing utensils, in the households with people. You don't get HIV by saying hello to anyone. This is Dr. Chinelo Animalu, the host of Medical Class 901 with Dr. Chi, and this is the show that talks about the major infections that plague us here in our Memphis community. So please make sure you tune in every Sunday at 6:30 to get a glimpse of this class. See you then. Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease Specialist and HIV Specialist. And today I have a special guest with me, Dr. Michelle Kitson, an internal medicine physician who is joining us today. And we have been talking about health disparity as well as health equity in our community, especially in the Memphis area. And so when we talk about health equity, it just basically means health justice, or where you have equal access to resources, power, to the entire community, not just to a specific group of individuals. And so residents of impoverished communities, when we talk about that, we mean residents of a community with less money than the average, are always at increased risk for mental illnesses, chronic diseases like diabetes, hypertension. They also at higher risk of mortality and decreased life expectancy. So Dr. Kitson is here with us, and she's a practicing physician, internal medicine physician, and this is something she deals with every day. And so she basically has been trying to help us understand what this health disparity in our community means. So Dr. Kitson, over to you.
Thank you. Again, ultimately, the workforce is impacted. People who are unwell are unable to go to work. They're more likely to miss days of work. They're likely to miss days in school. Therefore, it impacts the future of our children when they don't have good nutrition, when they are more inclined to develop diseases like obesity and overweight. They're develop conditions like osteoarthritis, which is, pretty bad joint pains, and they can actually find themselves with crippling physical conditions by the time they reach middle age. Many of our youth are not participating in PE like we did when we were growing up, and with that in mind, they are more sedentary, they are less likely to be engaging in activities that would lift their mood and spirit. Exercise is a phenomenal free way of being able to improve your health. But if you don't have a safe place in your community that you can come to without worrying about crime, theft, murders, then that robs you of your vitality and your ability to be a productive and contributing member of society. So this impacts everybody. And therefore, it is important for the wealthy and those that aren't wealthy, for our elected officials, for our community and social support systems to rally behind trying to bring about justice so that everyone can do better. We're only as good, we're only as healthy as the least healthy among us.
I'm glad you did mention that, because that's something I was thinking about, like, as a community, what can we do, like, for us to come together and see how we can improve this, improve the health this equity, in our community. For us as practicing physicians, what do you think, what role do you think we can play? And then the community at large, every single one of us, because like you say, it's something that affects every single person, regardless of what your race, what job, or what you're doing.
Absolutely. So one of the things that I think as physicians, we tend to go from a perspective of wanting to take care of people. And sometimes we can be a little arrogant, thinking we know exactly what people need. It is really important to be out there in the community, speaking with individuals and hearing from them exactly what it is they need, where they think that we can be of assistance to them, of benefit to them. We don't always have to reinvent the wheel either. There are places that will have community gardens. We are a city, but we're quite close to some rural areas. We can drive, those of us who have vehicles, to places where in Arkansas, where there's lots of fresh fruits and vegetables. If we can organize and arrange to get those things into communities that do not have access to transportation, I think that's one great way that we'll be able to improve some of the conditions of our patients.
Absolutely. And so one of the things that we see a lot in our community would be things like obesity, diabetes, that kind of, affects more of the minority populations. Do you think this has anything to do, it's part of the health disparity we talk about, but is this something that we can, educate our community members, the public, on ways to prevent this? You talked about, perhaps going to places like Arkansas or the rural areas where we can actually get more, healthier foods, and also, what I say, educate our kids on what would be considered healthy foods and what would be considered something unhealthy.
Well, that's huge. So a lot of times our society has moved us towards quick fixes, things that you can grab and go. And so if all you have in your community is a convenience store that has Takis and chips and cookies, and that's what you grab and provide for your children because it's a quick fix, there tend to be lots of food additives, high sugar, high fructose corn syrup, and these are known things that do actually put a burden on the body. The body does not process these things very well. And so if we could sub in an orange or grapes or plums when they're in season and get natural sugars as opposed to the manufactured ones that are quick grab on the shelf, then we can actually do much better as a society. Children actually will enjoy preparing foods and eating healthy foods if someone is able to do that with them. Unfortunately, in a lot of minority communities, parents are working too much. They're rarely at home, and children are either left to their own devices. So I think it's time for places such as community centers to be reinvested in, reinvigorated for those who may have children who are older, grandparent ages, to get more involved, to adopt a family, adopt a few children, help them to understand, the importance of drinking water as opposed to, juices and drinks that tend to make you more hungry, cause you to gain weight. And with the additional weight comes the additional burden of the major medical conditions. So I think sleep and exercise are also things that can be done.
Absolutely. So we are talking about health disparity in our community. I'm here with Dr. Michelle Kitson, and this is the Medical Class 901 with Dr. Chi, and we will take a quick break and we'll be right back.
Thank you for watching the Medical Class 901 with Dr. Chi. Dr. Chi MD is a renowned infectious disease specialist in the Memphis community. Without further ado, let's join the medical class with Dr. Chi MD.
Why do they always present it as it's a gay black man's disease? To me, it calls other people, like these teenagers you talked about, young people, to think that it doesn't affect them.
Well, the reason you're going to see that, in the commercials would be that the group that's most affected would be the black man who we call,
In the closet?
yes, you can say that, or we call it MSM, like, males who have sex with males, or,
Okay.
some people call homosexuals. And so that would be the largest, class in the, yeah.
So
in
they're the
entire country.
largest, but people shouldn't think that it's only them.
Oh, absolutely not.
Because then you can fall prey to this,
Yeah,
right? Because
yeah.
you think it is just about them because they never show me.
Yeah, and after that class will be black women. So, heterosexual women, black women. So it does affect everybody. So it's a life or death situation here, and part of what we're doing right now is the major hospitals or healthcare providers in this city. We are all coming together to work with the health department, Shelby County Health Department, and see what we can do. We are more than happy to go into schools and educate our young kids. Because, like I said, part of what we're seeing is lack of education or misinformation. So to be able to create this awareness, because this is something that nobody thinks about, till you find yourself in the hospital, and then, the doctors are like, oh, okay, you're HIV positive. You're like, wait, how? How did this happen?
Right.
So part of it would be to also, create that awareness. We need to keep that going. We need to let our people know that this thing exists and it is hitting our community the most. I mean, we are second in the entire country. Like that's not funny. Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo, Animalu, Infectious Disease and HIV Specialist. And today I have a special guest with me, Dr. Michelle Kitson, who is an internist. And we have been discussing about health disparity as well as health equity or inequity in our community. And Dr. Kitson is very knowledgeable and has kind of broken this down to us to a place where we all can understand what this means for us, for each and every one of us in our communities. And talking about that, so there's something that we've been getting a lot of, questions on social media about, and everybody has heard about the PEPFAR. What is PEPFAR? So this stands for the United States President's Emergency Plan for HIV Relief. And this is just basically funding that was made available by President W. Bush back in 2003, where United States became the first and the major country to provide funding for HIV and AIDS all over the world. And so in recent time with the new government, there's been questions and uncertainties about the U.S. pulling these funds away. And so this is also part of the health disparity talks, we've been discussing, because we know that minority communities have been affected the most by this pandemic, HIV/AIDS, that we've talked about a couple of times on this show. And so what does this funding do? So basically, this is the funding that helps with PrEP for HIV. And when we talk about PrEP, we are talking about medications that we give to people who are at risk of contracting HIV. So it could be PrEP, which is the you have the pre-exposure prophylaxis and the post-exposure prophylaxis. And these are just, steps or medications that we take or we give patients to prevent people at high risk of contracting HIV. And so majority of this medication is made available through this funding by the government. And so now we are all very concerned about the government pulling this funding. So I'm also going to ask Dr. Kitson, we all, take care of our brothers and sisters of our communities that have HIV and what this means for us.
Scary times that we're living in. When you consider that you have told us that Memphis is number 2, not in the South, not in the Southeast, not in the lower United States, but the entire country. Memphis is the number 2 with new HIV infection rates.
Yes.
It is absolutely scary to think that at a time when our community is being affected as much as it is, that we would be losing funding of very, very necessary drugs to prevent further spread and increase in the numbers of HIV. And so I would desperately appeal to our elected officials to assist us with ensuring that our federal government does not pull out of funding, because what impacts one community very soon will impact another, and our future is dependent upon having a healthy population. We have done so much to curb the spread of HIV up to this point. It once was a death sentence. With these drugs, we can prevent it, but it certainly is now considered to be a chronic disease. Yeah. We don't want to get it back to a situation where so many of our society members are being lost because they're unable to prevent the spread and the contraction of HIV.
Absolutely. Dr. Kitson took the word right out of my mouth, scary. As a HIV provider myself, I cannot begin to, express how scared I am. It brings a lot of anxiety because a lot of, majority of our patients depend on this funding, for their medications. And the thought of, taking this away, and as we all know, Dr. Kitson had mentioned it also, and I've mentioned this several times, our dear community here in Memphis, we rank number 2 in the entire nation for new cases of HIV, especially in our teenage population. And one of the major fundings, part of the fundings of this PEPFAR is actually geared towards preventing new cases of HIV. So this is really very scary, but this is a huge topic, and hopefully we're going to be able to discuss that during another class. But we want to keep everyone posted. Again, HIV, as we always talk about, is now a chronic illness, and we can say it's no longer a death sentence, as Dr. Kitson had mentioned. Why? Because people will have access. And we're not just talking about people here in the United States, we're talking about Africa. Africa as a continent has been the major benefactors of this funding. So the thought of pulling this is just beyond what we can begin to comprehend. And hopefully, as Dr. Kitson has talked about, we all can come together and talk to our legislative team and members and hope that this is something that does not get to happen. So Dr. Kitson, thank you so much for coming on the show with us today. This has been a major, major important topic to talk about because we're talking about not just, any minority communities at this point in time, but we're kind of talking about our entire communities. We've talked about how social, issues, economic issues, poor funding of our schools, can affect the longevity of the individuals in this community, leading to chronic illnesses and high mortality, meaning high death ratios. And so this is something that's going to be an ongoing conversation, but I want to thank Dr. Kitson for joining us today. And I hope that you'll be able to come hang with us some other times and take it from there. So thank you for joining us today. This is Dr. Chi from the Medical Class 901. With us today is Dr. Kitson.
Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee. Be sure to subscribe to our YouTube channel, Medical Class 901 on Facebook, and connect with Dr. Animalu on LinkedIn. Dr. Animalu's goal for Medical Class 901 is to bring awareness and prevention to infectious diseases plaguing the Memphis and Mid-South communities.